My name's Mark Haber and I'm a shoulder surgeon. We do two types of shoulder surgery. One is arthroscopic, that is keyhole surgery, and the other is classic shoulder surgery. Shoulder replacement surgery is performed when your shoulder wears out. Unfortunately, the shoulder joint, either the bones and cartilage wear out in classic arthritis, or the tendons wear out, or a combination of the two. The greatest advance in shoulder replacement surgery is the ability to use computer navigation. With computer navigated surgery, we can apply precision to shoulder replacements which we could never apply before. So we can take on more technically demanding replacements and still get the same precision we had with more straightforward cases. Shoulder replacement surgery takes about 2 to 3 hours in the operating theatre. About an hour to get set up, ready for the operation, and the operation itself probably takes not much more than 1 hour. The recovery following shoulder replacement is actually relatively quick when one compares it to, for example, knee replacement surgery. You may be in hospital only 2 to 3 days and wear a sling for about 4 to 6 weeks. Rotator cuff surgery is where we repair the tendons of the shoulder joint, that is the rotator cuff tendons. We call it the rotator cuff because it's a group of muscles that surround the shoulder joint that combine to form a cuff of tendon that attaches to the bone. The purpose of the rotator cuff is to stabilise the shoulder joint. It is what holds the ball within the socket of the shoulder joint. Unfortunately, as you grow older, not only does the shoulder joint wear out and one develops arthritis, often these tendons deteriorate and wear out as well. The weak link in the rotator cuff is where the tendon attaches to the bone and these tendons simply tear off the bone. When we do rotator cuff repair surgery, through keyhole arthroscopic means, we can reattach this tendon back onto the bone. The key in the recovery following the surgery is to avoid stiffness of the shoulder joint but not put a stress on this repair, because over the first 6 to 12 weeks the tendon and bone knit together, and it is very important that we don't perform too many activities that disrupt this very slow healing process. If you have shoulder pain, this may be due to wear and tear of your rotator cuff tendons or arthritis. We do have a number of options and you should speak to your GP about these.